So hi everyone, I'm Donna Coriel. I'm an internist and I created SoMeDocs a few years back. We're going on around 6 years officially, maybe a little longer in terms of when we were actually born. And it's a long story on our evolution, but really I did it because I realized that the online space is a really powerful tool and that physicians needed to really tap into that tool and build their own individual presence online. So I have built a slew of tools on in the website. That's doctorsonsocialmedia.com and all of our social media platform presence and platforms. And there's many ways that healthcare professionals can now get involved and use it. And I realize that it's a lot. And so I am going to start having these live seminars every, few months or so where I can explain very briefly what SoMeDocs is like. And then, especially if there's not a ton of people there, I can actually take you individually and show you maybe what there is to do for you, like one or two things or whatever it is. The reason I do that is because what I've noticed over the years is that physicians will get overwhelmed by what they can do at SoMeDocs. And because we're doing so much, I don't want to have to stifle that. Like, I don't want to have to close arms because it's just too much. I prefer to have a bunch of things available and then have all the doctors come in and then have like a few doctors use this function and then a few doctors use this function, et cetera, et cetera. So without further ado, if you need anything, just write it in the chat. I'm going to share my screen and I'm going to just take you on a very quick overview so you can see exactly what it's about. And then we can take each of you and you can either raise your hand and I can unmute you, or you could write questions in the chat as to what you're looking to do. And then I can show you where you fit in. So this is the website. It's a public website, which means anybody can go on it and see things. So doctorsonsocialmedia.com. We have three main public arms, like it says here. We have a content arm, and I can certainly go into more details, but each arm is very large in and of itself. We have a content arm, that's one. We have a directories arm, that's two. And we have a lectures arm, that's three. So the content arm is made of a magazine. It's made of series. And when I say series, I'm talking like Netflix. In fact, the tagline is like Netflix, but for healthcare. And we have a podcast. I'm going to open that up right now and just kind of show you the three items there, just so that, again, you could get a feel of what we have in the first arm, in the content section. So magazine, literally, it's a magazine. So doctors and non-doctors at this point, people submit articles that can be edited and beautified and optimized and made really great. And we not only publish them, but we circulate them. We circulate them in our newsletter. We circulate them really uniquely on social media. And we even sometimes give an option for the author to have follow-up questions asked of them so they can write another article with answers to them. Or sometimes we invite them into our series episodes to talk about those articles. So this is something really great. This is an option for many of you who are looking to get more involved and get more thought leadership with the help of a big site like SoMeDocs. And if you came to my last session, I just spoke about what SEO is. I taught about SEO just an hour ago. And so hopefully you caught that. And if you're a network member, you can watch that as part of the growth lectures as well to kind of learn about SEO and how you can use these articles to your own benefit of your own website. Our series section, I call, like I said, like Netflix, but for healthcare. And my apologies, it loads slow when it's on Zoom, but it literally is like Netflix, but for healthcare with all kinds of really fun series that you can look through and watch. So here's one example. We did a series. We did 2 seasons with Samuel Shem. He's the physician who wrote The House of God, and he's become a friend since we worked on this. It's fantastic. And, you know, you could watch or listen through podcast version, but you can watch or listen to episodes of him talking to different people. This season, he chose the people, but literally it's like Netflix, but for healthcare. So if you open one of those episodes up, you could really, you can watch the episode and you can sort of read about the guest, et cetera, et cetera. But there's different episodes, there's different series to watch, and each one is different. We've got a really funny one coming up called The Five. We have Stigmatized, we have SoMeDocs Conversations, we have Side Ventures, we have Doctors on Walks Getting Food, Social Dissections, we have Negotiate as a Physician, and there's definitely ways to work with us on creating a series of your own. So that's something to keep in mind too. The podcast portion I'm not going to open. Well, I'll open quickly and I'll just show you that it's literally what it sounds like is all of the, most of the shows that you saw there in the series section, those are all, those can be soaked up in podcast version as well. So that's all that is. So if you wanted to, let's say, listen to Even Doctors Need Life Lessons, you could come here and you could literally look through all of the different episodes of this series. Okay, so back to the front page and to the different sections. There's a directory section. When you open up the directory section, you could see all the different directories that we have. So we have the doctor directory, which those of you that have purchased a profile membership can have a profile in here. This doctor directory is public and is free to use. Similarly, we have a student directory for pre-meds and medical students. And we also have a new experts for doctors directory for the experts that have services that help doctors remain autonomous, et cetera. So I'm going to open that in just a minute. But before I do that, I'll move on to the next directory, which is the Beyond Exam Rooms directory. And that just brings you down to the little subsection directories. In Beyond Exam Rooms, you can see a podcast YouTube directory, books, blogs, speakers, courses. Each one of these is its own directory. So if a person is using our site and they want, let's say, to see which books are available and have been written by our experts, they can go here and they can open up any of these books, or they could filter their search and sort of look for a specific book on something, you know, a specific topic or a blog. So you can do that, and then you can open it up and you can read more about the specific book, like Christine Bashara's The Gut Revolution. And so you can read more about it. What is it about? And it's always tied into your profile. So this is really great. This website's very dynamic. So if I landed on her book page randomly, but I was like, let me learn more about her, I could literally open that up and it would open up her profile. In her profile, it's just more about her. And I could also see other things she's done, like she's giving lectures in our different conferences. And again, she's got her book. And for her, that's what she's done, her social presence. The really cool part here is the inquiries tab. Anybody out in the public can send you an inquiry. And that's something that's not really done very easily. For example, on LinkedIn, you usually have to pay and be a premium member to send certain inquiries over. That's something that doesn't have to be done here. We really want it to be transparent and quick. So you can open up any of these directories and learn more about, like, let's say the speakers, right? Which expert here is a speaker? Which expert in our cohort is a speaker? You could learn that as well. So et cetera, et cetera. You could learn about all the things we're doing on the side. And then we have a job board. So that's fairly straightforward. You can literally look for jobs. And you could subscribe to the job board as well. I'll open it very quickly, but you can literally either add a listing if you're a member, or you could get notified of every job that comes up as soon as it comes up, and you could use the filters, etc. And then finally, these directories are just a way to find things very quickly on our site. So if you want to find article, any resource on our site that have to do with a certain specialty, you could do that here. And you could similarly do that on topics. So let's say I was like, you know what, I really want to see everything that has to do with entrepreneurship. You would click that and it would bring up everything that's entrepreneurship related. And then you can even use the filters on the side to niche down your search. So let's say you're like, you know what, I really want to find an article on entrepreneurship. It would really narrow down your search to all of the articles that have to do with entrepreneurship. And you can then open it and read more about, and this is, an article in our magazine. You could read more about it. All right, that's the directories. And finally, before I open it up to you, well, let me go to the front. Finally, there's our third arm, which is our lectures arm. I'm going to open that up and just show you really quickly. We've got the live online conferences, which is the hottest the latest and hottest thing that we've built here. And I'll show you that in a second. We also have on-demand lectures, and we have another section called coming up for those things that are happening live and coming up soon. So if you open coming up, you can use the filters on the side to really figure out like, okay, I want to see what's happening in September. And so these would be your options, etc. Literally just use the filters or just look through and see exactly what conferences are coming up or what lectures are coming up, etc. So that's coming up. And you could also subscribe, by the way, to the coming up section so that you'd get a weekly notification of the different lectures that have been newly added in. And then there's on demand. On demand is all of the lectures that have already been delivered. You can find many of them in here that are free. So that's a really cool thing to do. And you would literally just set the cost bar to 0 and it would come up with all of the free lectures. And you could literally just click in and request to see the lecture. There's a ton of free lectures here. And we are continuing to grow this in really cool ways. We offer doctors a way to add lectures in here in order to collect emails, and I can answer questions on that separately, or maybe do a different Zoom session teaching you why emails are important. But emails are kind of like a modern day currency. So when you build up your followership, you want to build up emails of people that are interested in it, but it's very hard to do. So if you're posting videos to YouTube, as you know, you're not going to get emails. You're just going to get views. YouTube's the one that's getting the emails, not you. So I've built a way for us to actually build up an email list together. So each person that is speaking, anybody that clicks in and wants to watch their lecture, they have to drop an email and that email goes to that lecturer. So it's a really cool way to build up your email list. And some of those lectures are actually part of conferences. So for example, Writing to Heal is a lecture in a conference. So this one costs money and you'd have to purchase the conference in order to see it. But there's all kinds of different, like really cool things going on in this conference. So that's that. Let me actually open up a different tab. Okay. And then finally, and most excitedly, and then I will answer your questions, is the conferences tab. That's really the hottest item on our in our venture. And that's the live online conferences. Every month at this point, we have a new topic that's being covered. We have different target audiences. So the Leadership for Women in Healthcare is great for expert audiences, so for other healthcare experts, whereas the Menopause Conference is great for a general audience. So we invite both doctors that want to learn more about menopause or the general public. And so you can look through everything that we have, and there's much more that are coming. And the other thing you could do if you're a healthcare professional is you could actually get involved in them. So you can not only speak, you could be a panelist, you could be a moderator, you could literally have a bonus lecture be presented. You can do so many different things. You could be part of the SCC, the SoMeDocs coaching cohort, which is a new way to get visibility for you being a coach, which is open to network members. You can do a whole bunch of things. And this is built in a really cool way where we pay our so everybody that's involved gets something out of it. So the speakers will get, paid an honorarium, and then there's an affiliate link that the panelists can share and can make money that way. And it's all evergreen, so you can continue making money even after the conference ends, et cetera, et cetera. There's networking. There's all kinds of really cool ways. So I am actually going to, let's see. So there's already a question. How would you suggest that a retirement planning specialist use your site? I have a book that I could make available or a lecture. Okay. That's a good question. And that's where, so let's start with that instance. We're going to talk specifically to that person, and then I'm going to just spend a few minutes on it and move on to the next question so I can help all of you figure out where you fit on here. Oh, and by the way, the other thing I want to say before I show him is that there's also Facebook communities. So there's actual interactive spaces for all of these, which is really cool. So we have our SoMeDocs community where you can, if you have at least a profile membership, you can click in here and you could be a part of these really exciting conversations. There's Dr. Side Ventures for everybody that's interested in everything we can do on the side for side income, et cetera. And there's a lot of other groups that are coming up, especially in conjunction with their conference. So for example, we just held a non-clinical careers conference. There's a Facebook group for that. We're going to hold an AI in healthcare conference. There's a Facebook group for that. Here's leadership for women in healthcare, et cetera, et cetera. So there's a lot of different Facebook groups where we can interact as well. So for the person who was asking about if they're not a doctor, that's where this new membership comes up called Experts for Doctors. There's 2 levels of membership for Experts for Doctors. So what you would do is you would become a member at least at the profile level. And what you get is you get to be listed in this directory. And I didn't actually open a directory, so now you get to see these directories. This directory is specifically for Experts for Doctors. The other directory in parallel is a doctor directory. So you're not going to be in the doctor directory if you're not a doctor, but you can be in this directory if you're not a doctor. So this would be where experts can be shown in what we call digital business cards that lead to their profiles. So for example, and again, we just opened this, so it's brand new, but if I was a doctor and I clicked on here, I could use the filters here to find somebody that could help me in, let's say, leadership and professional development. And you could open up their profile and read more about them. For example, Dr. Chris Hill, he's a PhD doctor. This is him. He's a speaker, coach, conservationist. And then when I scroll down, I could read what he says. I am the president and co-founder at Hillside Communications. And he writes more. And again, anything that he does with us is going to show up here. He happens to most likely be speaking at one of our conferences. So once his lecture is submitted and he gets accepted, it's going to show up as his lecture right here. Everything that you do with SoMeDocs shows up in your profile. So anybody that finds you can send you an inquiry, freely send you an inquiry. And once we build a profile, we share it on social media. So the second that goes up and I publish it, it goes on social media, it gets scheduled in, and it also goes into our newsletter to introduce you to everyone, et cetera. Once, and the second level allows you to build a page into one of these directories. So for example, if you're a lawyer and you have a profile now built and you want to build a podcast page for yourself, or let's say you wrote a book and you want to build a book page, you would purchase the second membership level where your podcast can get a page built into the podcast directory right here, and people can learn more about your podcast, et cetera. From there, you could do other things with us. I don't want to spend too much time on this, and I will get to you individually. But for example, what you could do then is once you have a profile showing, you can talk to us about how you can write articles that are relevant to our audience. And this would be a really great way to get thought leadership for your specific topic. So for example, Dr. Daniel Paul writes regularly for us. And this is, for example, an article that he's written, and he gets a ton of thought leadership for being a private practice consultant, somebody who's built his own private practice and knows how, and now he helps other doctors to do the same. He loves SoMeDocs and writing for us because it gets him a lot of attention and he gets a lot of visibility and he gets people reaching out and saying, can I work with you? Again, they can, anybody who reads the article can click in and actually send him an inquiry and connect very, very quickly without any hindrances. So you could do that as a non-doctor, but you'd have to kind of work that with us. And there's other ways to do other things. For example, he's got a course, so he works with us to get an ad placed into his article without having to pay anything. It works through an affiliate. So we can talk about that separately to anybody that's here that has a course, for example, but we can definitely do that separately. So I'm going to now look at the chat. It looks like I answered that question. I'm going to stop sharing. We are still recording, so if you're not shy and you want to ask a question and come up front, we could do that. You can also just ask in the chat, tell me who you are, and I can find a way to fit you in there. Or you can wait until I stop recording and then ask me, and that's totally fine too. So I'm going to wait. And if you want to come up, just tell me in the chat because I have to unmute you and bring you up. Otherwise, you're muted. So I'm looking at the chat. I'm going to stop recording so that none of you are shy. So thank you for those watching.